Today, we are here to talk about vertigo, a complaint that is frequently seen in our outpatient clinic. What is vertigo? What are its causes? What treatments are used? We will try to explain it to you together. Vertigo is a condition commonly known as dizziness among the public. Vertigo is when a person feels as if they are spinning themselves or as if their surroundings are spinning. Yes, it is one of the symptoms that are perceived. At the same time, patients with vertigo may also experience nausea or, though rarely, vomiting. Vertigo is a disorder of the balance system as we know it. Vertigo can originate from the central nervous system or from the peripheral nervous system. What we call peripheral can be a condition caused by various issues in the chest, ear, or the musculoskeletal system.
Typically, vertigo patients visit either ENT or neurology. They don't come to us very often with vertigo complaints. Which group of patients gets this diagnosis, and how do you differentiate between them? Is it neurological or something else, and how is that distinguished?
First, when a patient comes in, start by listening to their medical history. Is the patient spinning, or is it the surroundings that are spinning? Patients sometimes describe it as if there's an earthquake happening, saying everything is spinning. We then consider whether the condition is central. Is it a neurological or ENT-related peripheral disorder? We must distinguish between the two. At this stage, the patient's complaints are at the forefront. If the patient has walking disorders, imbalance, and double vision, this is more likely a neurological disorder, and we refer them to neurology. The most common type of vertigo we see in ENT is benign paroxysmal positional vertigo. At the same time, Meniere's disease and vestibular neuritis are also frequently seen. These are also seen quite frequently. At the same time, we also have patients who present with vertigo complaints due to cervicogenic vertigo, which is related to the neck and can be seen with neck pain. What can you say about this?
Yes, it's not something that comes to mind. Vertigo originating from the neck. It isn't vertigo but dizziness, a sensation as if the ground is slipping away. Vertigo originating from the neck. Our neck doesn't only support our head, it is also very important for balance. There are various specialized sensors located here in the spine, muscles and tendons, called proprioceptors. With every movement of our head, these sensors send signals to our brain. They inform us about our position in space. But if there is any problem here, in other words, if there is a spasm in the spine or muscle, these signals get disrupted. The brain receives correct information from the eyes and ears, but information from the neck is incorrect. The brain has difficulty interpreting these signals. Because of this, dizziness, vertigo, or a feeling of the ground shifting occurs. Unlike the types of vertigo you are familiar with, this kind of vertigo is more often triggered by head movements. In other words, we feel it when we turn our head or tilt it backward. And it is usually accompanied by neck pain. It rarely occurs without neck pain. Vertigo originating from the neck is often confused with benign paroxysmal positional vertigo. Distinguishing them is vital, and we see this frequently. So how do we tell benign paroxysmal positional vertigo from this?
Benign paroxysmal positional vertigo, as the name suggests, is benign, meaning it's not serious. Benign, paroxysmal, meaning it comes on suddenly and lasts for a short time, and positional. In other words, it's a type of vertigo that changes with position, occurring when the patient turns their head from right to left in bed, tilts it back, or gets up from bed. In these patients, a feeling of fullness in the ear can definitely occur. At the same time, nausea can accompany it, and although it's rare, vomiting may also occur. This condition is commonly known among the public as crystal displacement. First, it's necessary to diagnose the patient. For diagnosis, we use a maneuver called the Dix-Hallpike maneuver. If we've made the diagnosis, we definitely try to reposition the patient's so-called stones with a maneuver called the Epley maneuver. So, do you recommend rehabilitation for these patients, doctor?
Yes. Patient rehabilitation is frequently overlooked. It is vital and beneficial. We implement a vestibular rehabilitation program for these patients to help regain their balance and improve their quality of life. It's very important to ensure head and eye coordination in these patients. For this, there are exercises called gaze stabilization exercises. How does this work? We draw a focal point or an object on a card and ask the patient to look at that focal point. Meanwhile, the patient moves their head. In this way, we help the brain adapt again. Another exercise we use is called habituation exercises. In this exercise, what we do is have the patient repeatedly perform the movements that trigger dizziness, and after a while, the body adapts to this and that feeling of vertigo starts to decrease. These patients often have a strong fear of falling. To prevent this, we work on balance exercises. We also do trunk stabilization exercises. They experience a lot of anxiety. They absolutely do not want to move and usually remain inactive. And these patients experience a loss of muscle mass. To prevent this, we do muscle strengthening exercises. We provide walking training so that they don't remain immobile and can become more active. And generally, we get good results. Of course, this process requires a lot of patience, but after a while, patients really come back saying that their vertigo has decreased. And when it comes to vertigo related to the neck, which is our area, after identifying the focus, we proceed accordingly. For example, if it's a trigger point in the anterior muscle group, usually this presents as a spinning sensation that occurs when the patient tilts their head back. In this area, we can perform trigger point injections, apply taping, and use physical therapy modalities. We make use of those. For back trigger points, we target that area too. We use various physical therapies and exercises. With neck-related cases, we achieve faster, more successful results.
May your world spin endlessly with pure happiness.
Yes, let's just say it's only from happiness.